Hi, Dr. Karin Drummond, owner of Drummond Chiropractic, and today I'm going to share with you the Epley Maneuver. It's a maneuver we do for dizziness and vertigo. Again, before you do this, make sure you talk to your healthcare provider, make sure this is an appropriate maneuver for your specific condition. So first, you need to find either a couch or a bed or a table, something that you can lay on so that when you fall back, your head's going to be an extension. And we have to find out which way you need to go. So you're going to be sitting and you're going to fall back as fast as you comfortably can with your head in extension. You can even have your head off of the bed if it's comfortable for your neck. If you're not dizzy, then you slowly turn your head to the left and then quickly go to the right and see if it makes you dizzy. And if it does make you dizzy, just pause for a minute, wait for that dizziness to subside. And then you're going to slowly and carefully go onto your right side. Put your feet off whatever you are on, be it the table or the bed. And you want to look to your right and press on the table or whatever you're on so that you can sit up very quickly as you turn to the right. And if you're dizzy, pause, wait a minute for it to go down, and then slowly bring your head to the center. If it didn't make you dizzy at all, then you do it the opposite way. So again, you fall back quickly, see if it makes you dizzy, turn slowly to the right, and then whip your head to the left. See how you feel. If you're dizzy, pause. Go on to your left side, looking to your left, and sit up as fast as you can when you're looking to the left. If that makes you more dizzy, then that's the way you need to go. Whichever way made you more dizzy, you repeat that 3, 4, 5 times. I wouldn't do much more than that because you don't want to get so dizzy that you get sick.
To understand how this works, you need to know a little bit about proprioception and the inner ear. We have 2 ears, each with a vestibular system that consists of a vestibule, which basically is a sac, and 3 semicircular canals, which are basically tubes, one horizontal, one anterior, and one posterior. Imagine each tube filled with fluid. At the end of the tube is an ampulla, which is lined with little hairs. As the head moves, the fluid flows, causing the hairs to move, stimulating sensory nerves that signal the brain of the head movement. There are also otolith organs that detect gravitational forces, how we sense going up and down in an elevator without even moving our head, as well as forward and backward movements, like nodding your head. Here, at the otolith organ, there are hairs with otoconia, basically tiny stones of calcium carbonate. As our head moves up and down, this movement causes the stones to move, pulling on the hairs, making the nerves that innervate them fire, sending signals to the brain, letting it know you're moving your head. Have you ever noticed when you turn your head, you can keep your eye on an object without even thinking about moving your eyes, yet they move to keep locked on the object? This is because the vestibular ocular reflex. Basically, your inner ears are telling your brain how your head is moving so you can reflexively move your eyes to keep your eyes locked on that object. For example, if you move your head to the right while looking at something, your eyes reflexively move to the left to keep the object in your visual field. What does this have to do with dizziness? Well, remember the little stones in the otolith organ? They can break off and get into one of the tubes. And normally this isn't a problem because the flow of fluid in the tube eventually brings the stones back into the sac where they do not cause any problems. But if enough stones break off at once, they can block one of the tubes. This blockage causes major vertigo because when you move your head, the blocked vestibular system in one ear fails to tell your brain you moved, while the unblocked vestibular system in the other ear tells your head you are moving. Can you see how this would make the eyes reflexively move incorrectly? This blockage can cause the eyes to move rapidly back and forth from this aberrant input. We call this nystagmus. Can you see how having nystagmus can make the world appear to spin? If you have nystagmus, your dizziness is likely from a blockage of one of your semicircular canals.
But the idea is to get the fluid in the inner ear to go in a way such that it pushes those otoliths out of the canal and into the sac where you won't be symptomatic anymore. You should notice that this helps your dizziness within like 2-3 days, and if not, you need to call your healthcare provider again and make sure that there's not another insidious reason for your vertigo or dizziness. Until next time, stay well.